Hello everyone. In today's topic, we are going to discuss about the pathophysiology of hypertension. So far, we have discussed about the anatomy and physiology of the heart, the cardiac cycle, the ECG interpretations, and so on. So, last topic we have discussed about what is hypertension, complications, causes, interventions. So, this topic will particularly see about the pathophysiology of hypertension, how hypertension is happening in our body. So if you have not subscribed my channel, please subscribe and share it with your friends. So pathophysiology, in that before studying that we have to learn few things. The first one is the cardiac output. Cardiac output is the amount of blood ejected from each ventricle. So as you all know that the heart is having right atrium, left atrium, right ventricle and the left ventricle. So the right ventricle, which carries the right side, it carries the deoxygenated blood, and the left side it carries the oxygenated blood. This right atrium and the left ventricle which carries the deoxygenated blood, and from the right ventricle the deoxygenated blood is carried to the pulmonary artery for purification, and from the left ventricle the oxygenated blood, it is being carried through the aorta to all the parts of the body. So the amount of the blood that is ejected from each ventricle in 1 minute, if you take in 1 minute how much amount of the blood that is ejected from the ventricle, that is called as the cardiac output. So the amount of the blood ejected by each contraction of each ventricle is called as the stroke volume. So if you calculate for 1 minute, it is called the cardiac output. If you calculate for the amount of the blood that is being ejected in one contraction, that is called as the stroke volume. So how to calculate this cardiac output is the stroke volume into the heart rate. So stroke volume is in one contraction how much amount of the blood is ejected into heart rate. Heart rate we calculate it for 1 minute. So for example, in a healthy adult at rest, the stroke volume is approximately 70 ml. Okay, so for each contraction 70 ml of blood is being ejected from the ventricles. So if the heart rate is 72, that is for 60 seconds, that is 1 minute, then what we can do is we can calculate 70 into 72, that is the 5040 ml. So if we are converting into liter, that is the 5 liter. So 1 liter is 1000 ml, so 5 liter means 5000 ml. So the cardiac output is 5 liter per minute. So this can greatly increase up to the demands of the exercise to around 25 liter per minute, and in athletes up to 35 liter. According to the demand of the person, the cardiac output, it varies and differs. This is just a rough calculation for a healthy adult at rest. So the increase of the cardiac output during the exercise is called as the cardiac reserve. As the person's cardiac output increases, means the person is having lot of exercises or something that workouts are being done. So the cardiac output rises. So peripheral resistance, as the name says, there is some resistance, there is some force, there is some difficulty. So opposite pressure is being applied, so the resistance is there. So it is also called as the systemic vascular resistance. It is the amount of resistance which is in the blood flow, and it's difficult for the blood to flow with resistance. As you all know that this is a normal artery, so this is the diameter of the artery. So here if you see the vasodilation increase in the diameter. So here the vasoconstriction, the blood vessel is being shrinked and the blood flow is diminished. It is very little, minimum, so comparative to the normal thing. So if you see this peripheral resistance, it is the resistance which is being created during the blood flow. If you see this picture, it is very clear. So this is a normal thing, the blood flows in the blood vessels. This is the plaque formation, the fat deposition. So as the fat deposits, there will be difficulty in the flow of the blood, and there is a resistance, increase in the peripheral resistance. So if you see, there is a complete block and the blood is not able to flow here. So in the blockages in the heart, most of the cases, this is the case because of the fat deposition. And because of this, the increased peripheral resistance is being applied. So the total peripheral resistance is used in the calculations of blood pressure, blood flow and cardiac function. These are the three cases where the peripheral resistance is being used. The causes of increased peripheral resistance in the blood vessels are atriolar vasoconstriction. Vasoconstriction means, as you see here, there will be a constriction, there will be shrinkage in the blood vessels. and increased sympathetic activity. That is the increased production of epinephrine and non-epinephrine. What does that mean? We'll see it later. See it now. Epinephrine. Example, in case of emergency situation, chasing of an animal. So if a dog, something is being chasing, then this epinephrine, the hormone, the amount of the epinephrine in the body is being raised. So in non-epinephrine means helps to maintain the blood pressure levels in case of emergency situation. In body, if the body is undergoing any emergency situation, then the non-epinephrine is being spiked out and it helps to maintain the blood pressure. We'll see more about it so that it's helpful for us. Epinephrine is also called as adrenaline. Then now we will be able to understand what is that, because every time we use the term adrenaline. So epinephrine is also called as adrenaline and non-epinephrine is also called as noradrenaline. So these hormones are released by the adrenal medulla. If you see the kidney, there is a gland over that's called adrenal gland. So adrenal gland, it is made up of the adrenal cortex and adrenal medulla. From this adrenal medulla only the epinephrine and the norepinephrine is being released. Epinephrine is released only during the stress. Okay, the adrenaline, as you know, that it's released only during the stress, and non-epinephrine released in the blood circulation continuously at low levels. So the non-epinephrine helps to maintain the blood pressure. It is released continuously at low levels. Only when there is an emergency situation, it is very much needed, the non-epinephrine level is being increased. Both epinephrine and norepinephrine can affect the heart, the sugar levels and the blood vessels. These are having a major impact on the heart, the sugar levels and the blood vessels. Norepinephrine can also make your blood vessels become narrower, which increases the blood pressure. So because we already see that the norepinephrine helps to maintain the blood pressure, because of the increased production, sometimes it causes the very too much narrowing of the blood vessels and it increases the blood pressure. So this is the flow chart. If you see the hypothalamus in the brain, which stimulates the sympathetic nervous system, which stimulates the adrenal medulla, this part, and it releases the epinephrine and non-epinephrine. So if to calculate the blood pressure, it is the cardiac output, as we see that the amount of the blood ejected in 1 minute. So amount of blood ejected in 1 minute into this peripheral resistance, how much resistance is being calculated. So if we multiply these both, then we'll get the blood pressure. So pathophysiology of hypertension, if you just study this flowchart, it will be more than enough to explain what is the renin angiotensin mechanism, the pathophysiology of the hypertension. There are two mechanisms. One is the renin angiotensin mechanism. Because of the plaque formation and vasoconstriction, there will be decreased blood flow and the decreased BP will be there. So as we have seen in the previous slide, there will be the plaque formation, the fat deposition, and it causes the vasoconstriction of the blood vessels. So what will happen? It will cause the liver to produce a protein called the angiotensinogen. Okay, so this causes the liver to produce a protein. As we all know that the kidney are the main part where the protein excretion, everything takes place. So what happened, because of this excessive production of protein, the kidneys wants to produce a renin, which breaks the angiotensinogen. So to break this angiotensinogen, the kidneys produces a product called renin. So this angiotensinogen is being converted into angiotensinogen 1. And what happens is, there is an enzyme in the lungs called angiotensinogen converting enzyme, which helps in the converting of angiotensinogen 1 to angiotensinogen 2, and this causes the vasoconstriction. If there is too much of vasoconstriction, what happens? The resistance is being raised and the blood pressure increases. So it is a very simple mechanism. The blood flow is diminished and the blood pressure becomes low. So the body thinks that I have to increase the blood pressure. What I can do, that automatically asks the liver to produce a protein called angiotensinogen, and to break this protein, the kidney produces renin, which causes the angiotensinogen 1 to being converted to angiotensinogen to convert into angiotensinogen 1, and the lungs, which causes this ACM enzyme that is being converted to angiotensinogen 2, and this causes vasoconstriction, increased peripheral resistance and increased blood pressure. After I'm explaining, if you want, you can see my click my blog link, and if you go, there will be a flow chart so that it's easy for you to understand. It is like a study module. It will be helpful for you. So that is another mechanism that is called the aldosterone mechanism. So as you know that there is a plaque formation which causes the decreased blood flow, decreased BP, and causes the renin angiotensin mechanism. That is what we already know. That is when that is being take place. It also produces the aldosterone from the adrenal cortex. So what happens? This release of the aldosterone, it causes the vasopressin, which is an antidiuretic hormone from the pituitary gland. So when this angiotensinogen mechanism it's being take place in the liver, the kidneys, also the adrenal gland, it produces aldosterone, which also releases vasopressin from the pituitary gland, which is an antidiuretic hormone. Antidiuretic hormone in the sense it will be like the body thinks that I have to increase the blood pressure, so I am not going to let out the water from the body to excrete it out, so I will just save the water. So what will happen, the kidneys, it will retain the sodium and excrete only the potassium, because water follows the salt. So as this happens in our body, the blood volume increases and increased cardiac output and increased blood pressure. So also by peripheral resistance the blood pressure rises, also by the blood volume. The blood volume is being raised by this vasopressin, which is an antidiuretic hormone. If you see in most of the patients who has very puffed with water content in their body, they will give diuretic hormone. But this vasopressin is an antidiuretic hormone which is being produced by this pituitary gland, which helps to retain the water in the body, and the kidneys is also retains the salt. Okay. So these are also the things which helps to increase the blood pressure, and the person will have hypertension. So these both mechanism, this is a single chart where both the mechanism renin angiotensin and aldosterone mechanism are AAS. So if you see the blood pressure that is being decreased, and renin, what the body will think that the renin, it is being produced by the kidneys, and it causes the angiotensinogen to convert into angiotensinogen 1, and from the lungs it is being converted from the angiotensinogen converting enzyme, it is converted into angiotensinogen 2, which causes the decrease in the peripheral resistance, and it will cause the blood pressure to increase. At the same time, the adrenal gland, which is being here, the adrenal cortex, which also helps to increase the blood volume by retaining the salt in the kidneys, and it will excrete only the potassium. So vasopressin, antidiuretic hormone, which is being produced by the pituitary gland. You just after this, if you just look into it, you'll be able to understand it better. So these are the pathophysiology of the hypertension. It's a very important question, so that it will be very helpful for you to know more about the other disease condition. So please subscribe and share to your friends. Thank you so much.